Hello class, my name is Jake Salter. This is my fitness education presentation. So we're going to jump right in. First slide is health and movement assessment. So first off, for the Part Q, my client, she's 29-year-old female. She does have a very poor family history. I would note a lot of, couple strokes, diabetics, some GI diseases that are hereditary. And then one she's actually been diagnosed with that's not hereditary and hasn't been reported in her family is Graves' disease. So this is a thyroid condition, kind of complicated in her case. And, there are some symptoms that come with it: increased heart rate, palpitation, shortness of breath, lightheadedness, etc. And there are recommendations by her doctor to not elevate her heart rate over 150 with exercise. That's important for our program, and I try to monitor that. She does wear Apple Watch that monitors her blood oxygen and heart rate constantly, so she does keep very close track of that. So for the health and movement assessment, the FMS test was used. So this test is great because instead of testing the client in a static position, we get to see them in dynamic positions as they're moving and performing functional activities. And so it challenges a lot of their lower extremities, upper extremities, core, and stability. Okay, so for the first test, I have my sheet here, the deep squat. So my client scored a 1 from the right and left. This was due to the spine not being parallel to the knees. The patient was loading her weight over her toes and therefore causing her knees to be positioned over the toes. And then there was a lot of increased lumbar flexion. So that's why she got a poor score. Her hurdle step, lower extremities are not in line with lifting that first leg. So when she lifts the first leg, the leg is not in line, and actually she rotates her hip in and brings her foot out. So this is a compensation pattern here, and it's kind of mostly due to stability and balance, and she's using the leg, bringing it out to balance herself. So next one is the inline lunge. She scored a 2. I gave her a 2 because she had difficulty getting in line with her front and back lower extremities. She had some trunk flexion, which notes poor hip flexor mobility / range of motion and alignment. And she also had poor stability, maintaining the alignment. Okay, next one is shoulder mobility. So this is the one where they reach behind the back. I gave her a 2 because she wasn't able to reach all the way and touch the hands, and she was more than one hand width away. And this was due to poor pec mobility range of motion, poor lat range of motion, shoulder external rotation range of motion. Now with the ASLR, she did score a perfect 3 on both sides, leading to good hamstring mobility. Okay, so that's her score on the FMS test. And then we'll get into the next in the program about how that relates to our progression. So for the periodization, the type of progression I followed was a linear progression. I did try and focus on flexibility, as this was a limiting factor in her FMS scores. As I noted, hip flexion range of motion, hip extension range of motion was limited due to hip flexor tightness. And also, it caused a little bit of lumbar lordosis, limiting her squat ability and causing a lot of issues. And there was a lack of core strength that did limit her lumbar, positioning during squatting. We also saw a lack of shoulder mobility, lack of balance and stability during some of the single leg exercises or inline leg exercises. And then the things I also try to focus on in the program included, upper body strength, core strengthening. We couldn't address balance because that would be a whole nother program that we'd have to build around and a different type of progression. I did try and include a good warm-up and flexibility, start to every workout. That way we can increase blood flow, circulation, warm up the tissue and prepare for the load of exercise and reduce the chances of any injury. Now, during this program, I try to do 6 days of training with the 4th day off. And this was proven to be effective in untrained individuals with a 2 to 3 day split. So I chose a 3-day split, upper body, lower body, and core days. And this was shown by one of the sources to be an excellent split for untrained individuals and showed an actual increase in strength. Anaerobic exercise too. They increase their cardiovascular endurance by doing 6 days a week with the 4th day off. And I try to vary the aerobic exercise so the client wasn't getting bored and was challenging different methods. Another study shows that you only really needed 45 to 50% of the 1 rep max to increase strength at 15 reps. So I kind of followed this plan in my exercise program. We were also limited on the amount of weight we had as far as equipment available to my client. Okay, and I try to keep resistance, kind of low since that's all we really had, and to a high volume of reps. Okay, now upper extremity exercise technique. So I chose for my client to perform rows with the bands, long sitting, and I noted in the video that when she was doing it, she was performing a lot of trunk flexion. Her head was strained looking down, and she was really leaned very far forward to where her head was almost at her knees. So I had her sit back, keep the shoulders back, trunk up, head in line with the trunk, and pulling back. So that way we're engaging the correct muscles. We get a little bicep, some deltoid muscles. We get the latissimus kicking in and engaging, rhomboids too. And when she was really leaning forward, we were using a lot of shoulders, anterior delts to activate. And so I wanted to make corrections to her posture and to the angle, the pull. Okay. And you'll see that in the video there. Now with lower extremity exercise technique, we did just a basic squat. She normally does it with a dumbbell. And I did notice we saw pronated feet, which led to the knees collapsing in, and it led to further difficulty pushing up into standing. And I also noticed that the patient's weight was on her toes, and she was too far forward during the squat instead of sitting back and dropping her butt. And then she has increased lumbar lordosis. So that we need to engage that core and flatten that back. Okay, so for my faith integration, I chose these 3 quotes. For Romans 12, verse 1, it says, "Therefore I urge you, brothers and sisters, in view of God's mercy, to offer your bodies as a living sacrifice, holy and pleasing to God. This is true and proper worship." So I took this as, taking care of your body in respect to God, as our body is His gift to us. Our health is His gift to us. We can't take this for granted. We have to take full advantage and build upon what He gave us, keep it healthy and use it to serve Him better. And in my field of physical therapy, this is very true. I have patients who take their bodies for granted and don't follow through with the exercises, or just didn't take care of their bodies before physical therapy, and they ended up in a very poor, condition, whether it's, cardiovascular disease because they lived a sedentary life, or, something as simple as maybe just putting off a knee replacement until it was far too late. Okay. Second verse was, "Do you not know that your bodies are temples of the Holy Spirit, who is in you, whom you have received from God? You are not your own. You were bought at a price. Therefore, honor God with your bodies." And I took this, as it clearly states, our body is our temple. We have to take care of it because our bodies were given to us by God so we can serve Him. And, that's something I hope to do in my field of physical therapy as I practice with my patients currently as an assistant, is to use my body, keep myself healthy so that I can better serve my patients. My job is very physical and I have to keep myself in good enough shape. I have unfortunately seen therapists who don't take care of their bodies, and the type of treatment they give their patients is lacking. I want to keep myself healthy so I can provide, so I can lift and transfer my patients, so I can help with pain relief, off of soft tissue mobilization, which takes considerable strength and energy and technique. I don't want my treatments to suffer because I didn't take good care of myself. Now, the last quote, I can do all this through Him who gives me strength. And I took this as God as our motivation to continue to push forward. God gave us spiritual healing and gave us a body that is just not only physical but also spiritual. And we need to apply our faith into everything we do and apply the lessons we learn from God in our careers as we guide these patients or clients, whoever they may be, to a healthier lifestyle and to a better life. God didn't just heal the physical bodies, but also the spiritual bodies. And we need to take that to our patients by being open-hearted, kind, patient, open-minded as well. And we have to understand the struggles of our clients and patients, assess, and find a way to help them, not just physically, but also spiritually. There's so much potential in what we do and the amount of good we can do for these people. And I hope I can be a force of change for them. Okay? And here are my references. I do hope this covers everything for this project. It was a great learning experience for me. I do hope that I can continue to apply this knowledge. I know I did have some areas of limitation. Let me put you on this slide so you can see me. I noticed I did struggle with, prescribing volume and frequency and putting the right amount of intensity for my patient. I did kind of struggle because we didn't have enough resistance and I didn't match the correct amount of reps to the low level of resistance. So I hope that I was able to correct that in my revised periodization and mesocycles. But I do feel like I did a good job at analyzing and breaking down each exercise, each of the FMS tests, and applying that into my program. I really chose to focus on flexibility and strengthening. I only wish that I could apply a balance program in our assignment, but I do understand that'd be a whole nother program that would need to be done. But it's something that I use every day in physical therapy. I identify a lack in balance, a lack in gait technique, and I'm able to perform balance exercises to improve gait technique, improve gait stability, whether they're using an assistive device or not. And this assessment is key to my everyday practice. So I will take this class with me and use it to improve my treatments, help my patients. And it's definitely been a learning experience. All right. Thank you, class. I hope you enjoyed my presentation. All right. Thank you.